Hi, I'm Dr. Kivett in Santa Rosa, California. I'm board certified in plastic surgery and dermatology, and with extensive experience in the reconstructive plastic surgery training, especially with respect to the upper extremity, that is the hand and the arm, and a 1-year fellowship with a plastic surgeon and an orthopedic surgeon whose practice focused solely upon the hand and the arm. I'd like to talk to you today about fractures of the bones within the hand, past the wrist, and also in the fingers. Then talk about dislocations of digits and ligament injuries. The function of the bones, of course, is that to provide a skeleton around which is a group of muscles, nerves, tendons, ligaments holding bones, joints together, and skin. And if the function of a hand is as important as it is, then there are things that we can do to help the hand that's injured adapt as it heals. When one considers a hand, the presence of all of those tissues makes it a multi-organ tool for the body. So, nestled within that skin envelope, all of these various tissues have functions and need to be maintained and or repaired when disease is present, whether it's acute traumatic disease or whether it's some type of cancer or whether it's an infection. The most common fracture in the hand, of the central part of the hand, is seen when someone who's riled up and is angry about something makes a fist and doesn't want to punch another person, so they go ahead and they punch a wall. And in doing so, the pressure that's applied to that end of the bone will sometimes buckle that bone. It will fracture it and make it bend in. Sometimes it won't bend in hardly at all, or sometimes it will bend in significantly. It's called a boxer's fracture, I guess because it was seen in some situations where a boxer of pugilist of some type was striking the jaw of his opponent in the ring. If there's over 60 degrees of flexion of the bone, this being 0, this being 20, this being 40, this being 60, then operative intervention will be necessary. Something less than that can be treated by looking at the bone, finding where the break is, either on the x-ray and by examination, and even by using a Novocaine injection to where the bone break is. And in applying that needle into that spot with pressure back on the needle, when you see blood, which comes with a fracture, come into the syringe, then you know you're in the middle of the fracture and can then go ahead and push the Novocaine into the center of that fracture, thereby numbing it. It's called a hematoma block, and this allows you to manipulate the bone without any discomfort to the patient. If the bone can be pulled into position, many times clarified with an x-ray, then it can be splinted or casted and left in place for several weeks, all the while leaving the fingers out so that the fingers can continue to do what they do, but with this bone being held by the cast so it doesn't move and it's allowed to heal again. The problem with a fracture is not just two-dimensional. In other words, if a bone breaks in this direction, then that is more prone to be treated more easily. But if the bone in its breaking and under the pull of various muscles also rotates, then you need to do operative intervention on the bone. If there's other fractures in the same ray, meaning in the same line with this bone, whether this is the 5th ray or the 4th ray or the 3rd ray, for example, then that forces the surgeon to work more with the operative intervention. And if there's some associated major soft tissue injury, that certainly makes for extra work. So it's important never to underestimate the value of a splint, a cast, and a very good occupational therapist who can help maintain the other joints in place while the bone is healing. If an incision needs to be made versus placement simply of some thin K-wires to help attach the bone to other bones, which works nicely in many cases, then the incision is made in an area so that quick access to the fracture allows us to place plates or screws or even wires across the fracture line. It's important that the blood supply to the bone be maintained because there's a thin layer of blood-bearing tissue that surrounds the bones called the periosteum, and that's important. As far as joints, fractures go, again, the rotatory change, the soft tissue injury makes us need to do something to repair those in an operating room. As far as dislocations and ligamentous injuries of the digits, it depends on where they're dislocated and how, because sometimes it's just that the joint is dislocated or the bone is fractured, or both the joint is dislocated and the bone is broken. So both of those elements have to be restored. So if you know someone with a problem of either acute or chronic nature, make sure that they see a physician that will help in that regard. Sometimes it's needed to happen on an urgent basis. And so if you can leave a comment or a question, give us a thumbs up. And if you'd like to hear more videos of an educational nature in general, please subscribe. Thanks very much.